Good evening, Terrence.
Good evening, Dr. Granger.
Well, it's good to see you back again.
Good to see you too.
Awesome. All right. Well, before we get started today, there's a couple things. I have some good news. After reviewing your x-rays and the exam that we did on the other day, definitely feel that everything that's going on with you is something that we can help you with here. Okay? Because you have chosen chiropractic, definitely want to tell you a couple things about chiropractic. Take a look right here. We are the #1 choice in alternative care. Not only are people realizing, okay, I'm getting older, living longer, but I want to live a more functional life, and that's basically what we are about. And the other great thing about it is that chiropractic has treated conditions like yours successfully for the past 100 years. So with that being said, we do have a 95% satisfaction rate with our patients. So not only will you be coming here, but you will be feeling better, and that's our ultimate goal for you. Okay? Now on to the most important question. Typically, everyone, #1 question at this point is, what's going on with me? Why am I feeling this way? What happened? I will say that it isn't one particular thing that caused this problem, this low back pain that you're having. It's an accumulation of things over time. Things just gradually have built up on top of each other till we've reached this point. From the time you were born, throughout your life, different traumas, things of that nature that you've experienced, from learning how to walk to playing sports, all of these things have just built on top of each other. And if you think about it, you never really got them taken care of. So if we think about the tires on our car, for instance, if we never rotate the tires on our car, what will happen?
One side will be rougher than the other.
Exactly, and eventually you'll have a blowout. Same thing with your body. If we're constantly putting stress and trauma on our body and we never take care of it, eventually we'll have a flare-up. And that's where we are now. Okay? Now, when we talk about what's going on with you, let's really get down to the cause of it. The cause is that word subluxation that they talked about on the video. And basically, that is what happens after the stress and the trauma is being placed on your body repetitively. Subluxation is when you have the slightest rotation within your spine. When that happens, it puts pressure on these nerves, irritating the nerves. That's why you experience possibly the pain, the numbness, the tingling. Okay? And what our job here is to do is to find those areas and correct them. And when you get home tonight, I want you to take a look at this yellow box and read through it. You'll find some things that may be familiar to you that you've experienced, or even some family members or someone close to you. And it's pretty amazing to see some of the stuff that can be caused by simple subluxation. Also, another cause is degeneration. Over time, as we have wear and tear on our bodies, degeneration will form. This is a picture of the normal spine here. As we go to the right, you see that disc space, which is nice and healthy here, it starts to decrease. Can you see that? Alright, this picture over here, this is the worst stage of degeneration. That's when the bones start to fuse together and it looks more so like this here. Not very pretty, right?
No.
Exactly, so we can only imagine how that feels. And also it limits your range of motion, you're not as flexible as you used to. All of these things start to happen. So what our goal is to keep you as close to normal as possible. Now, after looking at your x-rays, I placed you in more of a phase 1 degeneration. Okay? You're about right there. And that's the beginning of it. So even though it's the beginning, it's still very important because it can lead to that severe case that I was talking about. Now let's take a look at your x-rays. So right here, this is a picture of your neck. As you saw in the video, you should have a nice C-shaped curve in your neck, but you don't. Your neck is more like this when it should be like that. And that's a problem. That can lead to certain areas being more worn out than another and that causing the degeneration. So what our goal is to help you restore that curve within your neck, relieving the pressure. Now we're going to take a look right here through the back. These little white spots, those are your spinous processes. They should go straight up and down, but they don't. If we take a look at your white spots, they're kind of like dotted everywhere. That's the rotation and that subluxation that I was referring to. So that can potentially lead to some severe pain. Now I know your main concern was the lower back because that's where the pain is. So let's take a look here. This is a picture from the side. Right down in here, this is our problem area. You see how these spaces have nice healthy areas, but right through here is not so much. That disc has begun to be worn out, okay? It's too much pressure being placed there. So this is the area that we really need to focus on. Also, right here from the back, you see your hip bones here. This left side is up higher than the right side. So it's almost as if you're walking unlevel, and that too puts stress on this lower back, okay? Now we've talked about all the bad stuff, so to say. Let's talk about some of the good things, the solution to your problem, okay? The solution is going to be a series of adjustments as well as some therapies to help supplement those adjustments. The adjustments are basically going to be us realigning and correcting those areas that are giving you problems. I've recommended for you a total of 18 visits, okay? Now, we break this down into 3 stages. Initially, we have our pain relief stage, and that's a very important stage for you because, of course, we want to get you out of pain. And with that being said, we have to be very aggressive. So, we're recommending that you come 3 times a week for 4 weeks. Okay? And like I said, at that point, we'll be doing therapies as well to supplement. Yeah. After that point, you'll be probably feeling really good. And you'll probably think, oh, great, I'm feeling great and I'm done, but you're not. Okay? At that point, even though you're feeling great, your body is not yet stable. You can do the slightest thing like bend over and pick up a piece of paper and flare things right back up. So that's why it's important that we go into that stabilization phase. Once we start stabilizing things, then you'll be able to get to the point where you can do the things you want to do and not have to worry about this. The stabilization phase is 2 times a week for 2 weeks. After that point, I feel very confident that you'll be ready to move into our preventative stage, and that's just preventing this from ever happening again. You know, we're constantly putting stress on our body. You're not going to change the things you do on a day-to-day basis. So you have to take care of your body so it can handle that. The same with your teeth. You know, we brush our teeth. It'll be nice once we brush our teeth and we clean our teeth if we can go eat whatever and never have to worry about it again. But you still have to get your teeth clean because you're constantly putting the food in your mouth. With your body, you have to maintain it because you're constantly putting stress on it. Okay? Sounds pretty good to you?
Sounds good.
All right. Now, a couple things here, Terrence. As a patient, we ask 2 things of you. Very first thing is that you follow our recommendations. It's very important because we don't want you to get to a point where you're out of pain, feeling great, and then perhaps you feel like, okay, well, I don't necessarily need to come in anymore. Then we see you a month later in severe pain, worse than probably you are now, costing more money and even more time, okay? Secondly, we ask that you attend our How to Stay Young class. It's a very informative class that I feel is very essential to your life as well as your family members, and it's very beneficial and something that you can learn great things from that you probably never heard. Okay, this is something that you can take with you for the rest of your life. I've included 2 tickets here. These tickets are for you and a guest. Okay, someone close to you, special to you that you can bring with you to the class. It's offered 3 times a week, Mondays and Wednesdays at 6 and Tuesday at 1. Okay? What day do you think I can put you down for?
Tuesday at 6.
Tuesday at 6? No, Mondays and Wednesday at 6. Tuesday at 1.
Okay, Tuesday at 1.
Tuesday at 1? Alright. And I'll put, who will you be bringing with you?
My mother.
Okay. I'll put you both down for Tuesday, and you'll give this to Miss Ebony when you meet with her regarding your appointments and your insurance, and you'll let her know and she'll get you scheduled.
Okay.
Any questions for me?
No.
Alright. You ready to get started?
Mm-hmm.
Alright.